Liver cirrhosis, the silent disease destroying America's health, and what you need to know right now. Liver cirrhosis is one of the most dangerous yet overlooked health conditions in the United States today. Every year, thousands of Americans are diagnosed with advanced liver damage, and many of them had no idea their liver was failing. Cirrhosis does not usually begin with dramatic symptoms. It develops slowly, silently, often over many years. By the time noticeable signs appear, significant and sometimes irreversible damage has already occurred. That is why understanding cirrhosis is not just medical knowledge, it can literally save lives. Cirrhosis is the final stage of chronic liver disease. It occurs when healthy liver tissue is gradually replaced by scar tissue. The liver is one of the most important organs in the human body. It filters toxins from the bloodstream, helps digest food by producing bile, stores energy, regulates blood clotting, balances hormones, and supports immune function. When repeated injury happens, whether from alcohol, viral infections, obesity, or other causes, the liver attempts to repair itself. But constant damage leads to fibrosis, and over time, that fibrosis becomes extensive scarring. Once scar tissue takes over large portions of the liver, blood flow is restricted, liver cells die, and the organ can no longer function properly. This condition is called cirrhosis. In America, the leading causes of cirrhosis have shifted over the past decade. While chronic alcohol use remains a major factor, one of the fastest-growing causes today is non-alcoholic fatty liver disease, NAFLD, strongly linked to obesity, type 2 diabetes, and metabolic syndrome. With over 40% of U.S. adults classified as obese, fatty liver disease has become a silent epidemic. Many people assume liver disease only affects heavy drinkers, but millions of Americans with no history of alcohol abuse are developing severe liver damage due to poor diet, insulin resistance, and sedentary lifestyle. When fat accumulates in the liver and triggers inflammation, it can progress to non-alcoholic steatohepatitis, NASH, then fibrosis, and eventually cirrhosis. Chronic viral hepatitis, especially hepatitis C and hepatitis B, is another significant cause. Fortunately, modern antiviral medications have revolutionized treatment for hepatitis C, offering cure rates above 95%. However, millions remain undiagnosed. Early screening is critical because untreated viral hepatitis can silently damage the liver for decades before symptoms appear. Autoimmune liver diseases, genetic disorders like hemochromatosis, iron overload, and conditions such as Wilson's disease also contribute to cirrhosis cases across the country. What makes cirrhosis particularly dangerous is how subtle early symptoms can be. In the beginning stages, many individuals feel only mild fatigue, reduced appetite, occasional nausea, or slight discomfort in the upper right abdomen. These symptoms are easily dismissed as stress, aging, or minor digestive issues. Routine blood tests might show mildly elevated liver enzymes, but unless further evaluation is done, the underlying problem may continue progressing unnoticed. This is why cirrhosis is often referred to as a silent killer. As the disease advances, more alarming symptoms begin to develop. Jaundice, a yellowing of the skin and eyes, occurs when the liver can no longer process bilirubin. Fluid may accumulate in the abdomen, a condition known as ascites, causing visible swelling and discomfort. The legs and ankles may also swell. Because the liver produces clotting factors, severe scarring can lead to easy bruising and bleeding. One of the most dangerous complications is portal hypertension, increased pressure in the veins supplying the liver. This can cause enlarged veins in the esophagus, varices, that may rupture and lead to life-threatening internal bleeding. Another serious complication is hepatic encephalopathy, where toxins build up in the bloodstream and affect brain function, leading to confusion, memory problems, personality changes, and in severe cases, coma. A common question Americans ask is, can cirrhosis be reversed? The honest answer depends on the stage. In early compensated cirrhosis, where significant scarring exists but the liver can still perform most of its functions, removing the underlying cause can stabilize the disease and sometimes partially improve liver health. For example, complete alcohol cessation can dramatically improve survival in alcohol-related cirrhosis. Weight loss of even 7 to 10% in patients with fatty liver disease can reduce inflammation and slow progression. Treating hepatitis C with antiviral therapy can stop further damage. However, once cirrhosis becomes decompensated, meaning serious complications like ascites, bleeding, or encephalopathy have occurred, the scarring is largely irreversible. At that point, management focuses on preventing complications and evaluating for liver transplantation. Modern medicine offers several treatment strategies. Lifestyle modification remains foundational. Complete avoidance of alcohol is non-negotiable for alcohol-related disease. A balanced diet rich in whole foods, lean protein, vegetables, and fiber supports liver health. Reducing sodium intake helps control fluid retention. Managing blood sugar in diabetic patients is critical. Physicians may prescribe medications such as diuretics to manage ascites, beta blockers to reduce the risk of variceal bleeding, lactulose or rifaximin to treat hepatic encephalopathy, and antivirals for viral hepatitis. In advanced cases, liver transplantation becomes the only curative option. The United States has some of the most advanced transplant programs in the world, and one-year survival rates after liver transplant exceed 85 to 90% in many centers. Life expectancy with cirrhosis varies significantly depending on severity. Doctors use scoring systems such as the MELD, Model for End-Stage Liver Disease score, to estimate survival and prioritize transplant candidates. Patients with compensated cirrhosis may live many years with careful management. Those with decompensated cirrhosis face a higher risk of mortality without transplant. Early detection dramatically improves outcomes, which is why routine screening and proactive healthcare are essential. Beyond the physical impact, cirrhosis carries a heavy psychological burden. Many patients experience anxiety, depression, social isolation, and fear about the future. The financial strain of chronic illness, frequent hospital visits, and potential transplant evaluation can be overwhelming. Mental health support, counseling, and community resources play an important role in comprehensive care. Addressing emotional well-being improves treatment adherence and overall quality of life. Prevention remains the most powerful weapon against cirrhosis. Americans can take concrete steps today to protect their liver. Avoid excessive alcohol consumption. Maintain a healthy weight through balanced nutrition and regular physical activity. Get screened for hepatitis B and C, especially if born between 1945 and 1965, or if other risk factors are present. Control diabetes and cholesterol levels. Be cautious with over-the-counter supplements, as some herbal products can cause liver injury. Schedule routine blood work and discuss abnormal liver enzyme results with a healthcare provider. These actions may seem simple, but collectively they can prevent years of silent damage. The liver is remarkably resilient. It has an extraordinary ability to regenerate when given the chance. But that regeneration has limits. Cirrhosis does not develop overnight. It builds gradually through repeated injury. The tragedy is that many people only learn about their liver disease during an emergency hospitalization. Awareness, education, and early medical evaluation can change that story. For the American audience, the message is clear. Liver health is not just about alcohol. It is about metabolic health, viral screening, lifestyle choices, and proactive medical care. In a country facing rising obesity rates and metabolic disease, cirrhosis is behind the public health crisis. Yet it is also one of the most preventable chronic diseases when addressed early. If you or someone you know experiences persistent fatigue, abdominal swelling, yellowing of the eyes, unexplained bruising, or confusion, do not ignore these signs. Seek medical evaluation immediately. Early action can mean the difference between manageable disease and life-threatening complications. Liver cirrhosis may be silent at first, but knowledge is powerful. The more Americans understand about this condition, the more lives can be protected. Your liver works for you every single day, filtering toxins, processing nutrients, and keeping your body balanced. Protecting it is not optional. It is essential for long-term health and survival.